And 2 weeks later, we did a 90-minute Zoom call with Blue Cross, and their audit team, went through, questions that I had, and I tried to train them on, a couple different pieces, like what is RTM actually? I explained it to them, and how it's different from remote patient monitoring, which they're somewhat familiar with, and how remote therapeutic monitoring is for monitoring therapeutic activities like exercise and rehab, and it's designed to improve patient compliance with their own programs that the physical therapist or the occupational therapist creates. It's clinically viable, not just a billing opportunity. And then I went into like what does good documentation look like, and where it should be, where the consent is, where the data collection lives, how the time is supposed to be tracked and logged, and how there's supposed to be a phone call that's made, and how that's supposed to be integrated with clinical care. We went through, what does it look like, what to look for in an audit, like what are some red flags, things like no evidence of patient consent, billing for patients who aren't using the system, so there's no data being collected. That's a big one. If there's no data transmission, that's not great. Billing for monitoring time that didn't actually occur, no clinical integration, meaning they were just checking boxes to bill codes, and so that helped them, I think, understanding that the phone call is important, that there's got to be clear consent, clear patient engagement, documented, the monitoring times and the activities that are occurring in the time logs, communication between the remote, person who made the call and the treating therapist, and how important that is, and how clinical notes, showing that there was RTM data that influenced that treatment plan. And some common misconceptions I try to teach them about was like, there's, you don't need a wearable device, you don't need EMR integration, right? The monitoring can be done by remote, but they have to be licensed providers. And the 20 minutes that happens, needs to include not only reviewing, communication, and documentation, but there needs to be an actual two-way audio communication with the patient, right? And so at the end of all this, the training, the audit director said, thank you for this.